Hello, and welcome back to LTC Heroes Live by Experience Care. My name is Peter Murphy Lewis, and I am the host. And today I'm lucky to be joined by my co host, Victoria Rama, and also with a guest, Laura Sandy. She's the regional administrator at Foundations Health Solutions based out of Columbus, Ohio. And before I allow her to introduce herself, those of you who have followed LTC Heroes, you know, those of us here locally are big fans of her organization. We have interviewed Brian Spillman, which is one of the reasons I became a CNA. Or sorry,
Um,
Bob Spillman,
yeah.
the vice president of business development and culture, and also Brian Colleran, who's the owner and founder. Laura, you are filling big shoes here on the program because we're
Oh,
big admirers.
yeah.
Tell us a little bit about what you do in the organization and how you became to know Bob and Brian.
Sure. I've actually been with Foundations almost 6 years now. My current role with them is senior administrator here in Central Ohio, and I have 11 homes in my region. We're currently in the process of opening a new building called the Landings of Westerville, and that's going to be opening in June. So, working with the team to get a new building launched also.
That
So,
that's
really,
that's exciting. Is it nerve
operations.
wracking as well?
Uh, no. And now, of course, now I'm starting to look at staffing and putting that stuff together and trying to figure out where my staffing pool is going to come from. But very exciting opportunities, and from the ground up, getting to see not just a new building, the bones of the building, but how are we going to make it so our residents want to live here and our staff want to make this a committed place to work. So that's really where my mindset is right now.
Victoria, I'll let you take the lead. You like to hear about people's stories. What do you want to ask Laura?
I do. That's very exciting, Laura. I just wanted to know how, like your introduction to long-term care. Where did it start? Did you always know you like this industry? You wanted to work for long-term care, or did it just happen for you? And how long have you been in the industry?
So I've been in the industry a long time, right through college. So over 20 years, have been in it. Honestly, my first exposure to a nursing home came from Vacation Bible School. Every year, they would take the church kids in and you would sing at this nursing home. And there was one individual, his name was Danny. I can still see him clearly. And as I was a kid, I just remember him smiling at the kids singing, and just that interaction was so precious. So when I went away to college, actually, I had a 3-hour break between classes. Well, I wasn't going to sit on campus, and there was a nursing home right next door. So I thought, why not just go volunteer for a couple hours, right? Between these 3 hour. And it quickly went from, sure, you're a volunteer calling bingo, to, hey, do you want this job in activities, to, you need to get activities certified. Oh, now you're going to be a social worker. And it just kept going. My degree initially, I quickly realized like I want to be an administrator, but I took the road of getting my bachelor's degree in social services, and especially in like marketing, and then went on to get my license, to learn the business aspect of it later. So that's actually how I ended up in operations, did admissions marketing for a few years, and then took my first building at the age of 24. I think I was crazy. Now I look back, I'm like, wow, I really was the Kellogg's kid. I had no idea the responsibility, but it was a fantastic opportunity at my first building that I took down in Washington Courthouse, and have been an administrator or a senior admin since.
I
Wow.
I I was preparing for this interview with Victoria about an hour ago, and I said, Laura's been an administrator as long as Victoria's been alive. And we laughed and we're like, we're
Yes.
going to get a lot of advice from you. Can take me back to how old were you when you realized you want to be an administrator? And what was it about either the
Mhm.
person that was the administrator that made you want to do it, or the role? What was it that you knew so young exactly what you want to do? Because I'm 41 and trying to figure out what I want to do.
The administrator at the time, very nice lady. But I remember watching and quickly thinking, I think I could do this better and different. And you either learn from a mentor, like someone you're like that wows you, or to me, she didn't wow me. And I realized quickly like the impact that a good administrator, a positive administrator could be. So it wasn't that she was a bad administrator. She just wasn't that impactful leader. And I quickly realized, I'm like, hey, this is my skill set. I can impact 100 people's lives every day and be in this environment. So quickly, by the time I was 19, I'd figured out I want to at least try this career path.
Were you intimidated?
No, I will tell you my first job I took was, I was probably naive beyond belief. Like I felt like I knew long-term care. It's a people business, and I enjoy people. So I feel if at that point my mindset was, if you're respectful to individuals and you're a hard worker, you can normally work things and get things in the right direction. Now, what I didn't expect, my first building was a union building. And I remember I took the job and they said, yeah, don't worry, that union's really quiet. I'm like, okay, all right, fine. And I'll be darned, within that first 90 days, they went into union negotiations. And I think it was a shock to me in that moment in time. People, I'm like, wow, they are slicing my tires. They don't want, you quickly learn your labor laws. And I thought, okay, this is a totally different side of the business that I didn't know. But really prepared me to understand my labor laws. And I would embrace, I don't support unions in healthcare and the nursing homes. What I will say is, if you treat your employees by those labor laws and really think of treating people consistently and fair, you're not going to have an issue with your labor and your staff. So I took something out of a challenging situation and really enjoyed what I learned from that building.
Victoria, what was it? I know you helped me prepare the interviews for Bob Spielman and also prepare a lot of the blogs. What was it about the culture at Foundations Health Solution that you wanted to follow up with?
It reminds me a lot of what Laura just said. It's a lot about embracing the employees that you have and make sure they feel valuable inside of your company. So it's actually super it's funny to see how both of the speeches from Laura and Brian and Bob, they are the same. It's really nice.
Laura, how would you describe yourself as a leader?
Boy, I would certainly say I'm approachable. It's funny. I just, you know what? I want to know the people that are working with me. I challenge myself to know something about them and to find out what motivates them to help develop them. And whether it's the nurse's aide that never got her GED and now is going to school because for years we have encouraged and worked through that schedule. It's just trying to know people individually. And as my jobs have changed through time. Maybe I'm not impacting 100 direct line staff members, but now I have 12 administrators, and trying to make them dynamic leaders and understanding that to try to be empathetic to our staff where we can, but to understand that our staff members have full lives and these jobs that they work are not tremendously just stressful, but also hard on the body. So just recognizing people where they're at in their moment and letting them know how valued they are, and always having that respecting people and then getting to the work and getting stuff done so we can get to the fun part too.
One of the words you just mentioned came up in our prep session this morning, Victoria. She said, look at Laura's LinkedIn. It said she loves working with dynamic professionals. That's not a word that we often hear in long-term care. Why does that stand out to you, Laura? And what does it mean to you?
I think you heard me say I was a social worker. So that piece here, and when I try to describe long-term care and the staff, any given time, we're working in a multicultural situation, different races, different religions. That in itself, you take that component, different ages. My goodness, you could be my daughter, and I think I started this when I was 19, and all the different ages that we have on top of. We have individuals that have their GED, and then any given minute, the next conversation I'm having is with a physician or the nurse practitioner. So all levels of education, just it's constantly changing who you're interacting with. In that this group of individuals from all these different backgrounds come together and just make something so beautiful for our residents. That's actually what keeps me going. Just it's never boring.
I'm going to follow up on that question, then I'll let Victoria take over because I know she has some questions. My question is, related to your passion in terms of how it overlaps into your personal life. Do you have any stories of either a memory you had from a resident saying something to you or giving something, or a family member when a resident passes that stands out to you and you kind of take that home and you're like, this person taught me how to hug my husband or say something to my father or interact differently or listen differently?
I've had so many, but probably, those first experiences are kind of what bind you. And if my dogs go crazy here, I am so sorry.
Would you please introduce them? At LTC Heroes, we're dog lovers.
Oh, I love it. Well, when they come flying around here, I can hear them back there.
Okay, we'll tell you.
One of my first, and this is before I was an administrator, was in activities. There was a gentleman, Mr. Graham, and Mr. Graham also went to the church I went to. So he's an older farmer, and he ended up being in the nursing home I was in. And so he and I, of course, became good friends. So throughout the years, his family was not local. They might come in for holidays or quarterly, but he and I had a good bond. And I still remember he liked me, but he really didn't like going to many activities unless if it was like church related. And he would sing the Old Rugged Cross in that broken voice as he would belt it out. I mean, it just always brought tears to my eyes in those moments. So when Mr. Graham passed away, again, I was young, 19, 20. I'm like, I can't believe this. But the impact I had with that family and those relationships, trying to connect so they knew where he was at that moment in time, even though they couldn't be there. They actually asked me to speak at his funeral. So I was one of the people that gave this gentleman's eulogy. And at that point, I just realized this is helping families connect. Of course, I had something very precious being given to me at the same moment. But that's something that sticks out. I'm like, wow, it's not just a job that you do. It impacts your life. Now here, because, now I'm a mom, I've got kids in this big school district. It's nothing. A week ago, I had a school teacher reach out and say, hey, I have kiddos that are looking for pen pals. Can I connect this? And another teacher says, hey, I've got chickens. Can you hear these dogs? Guys, please. So sorry.
We can't hear him very well, but it brings joy to our day.
Good.
Oh, there we are. What's their names?
This is Willie Nelson and Rizzo. I don't know if you can see them both. So they're sweeties. Yeah. So did that answer some questions like how it intercedes with my personal life also?
It did. Thank you.
It's all in one.
That was beautiful. So like we said, you've been an administrator for 20 plus years now, but you've also been an administrator during COVID, which I bet is a total different story. So what did you learn personally, professionally, and
Wow. Gosh, if we don't all get everyone that was in buildings, truly, I don't think, unless you were on the lines, the consistency of how hard it was. You just heard me tell one story about someone that I was close to that amplified that. There's 20 of them. It was a hurtful time for the staff. And I think as administrators, our role, we really stepped up. If there was ever a time to be a leader, that was the moment whenever their backs were against the wall in so many ways. And to be that voice of cheering people on, even when we knew it was difficult, but you were there for them. There were some dark moments when buildings were losing our residents, especially residents that you loved and had been with you for years. So I think at that point, just knowing the relationships we have as professionals together and supporting each other was so important. I remember one night, of course, this is probably like before Omicron. By this time, we're like round 3. We're tired. We're done with this. Like, it's just frustrating at this point. I remember working the floor that day because it wasn't that staff were calling off. People were sick. My staff were sick. Of course, you've got the survey people coming in, breathing down your back, like, somebody didn't wear your N95 right. And we wanted to kill these surveyors. Did someone really just doff that correctly? I'm like, are you kidding me? We have people dying. I don't have enough staff, and this is your concern in this moment. Okay. So I came home, and I actually just wrote a poem, and I put it out on Facebook to my healthcare friends. And just like, I see you, I hear you, I know how hard it is. And it was kind of interesting how that grew legs just quietly, like the forwarding, because it's authentic, knowing genuinely how hard everyone worked. And it wasn't just a physical love of labor. They were giving their souls. So just appreciating and being authentic to them. Like, guys, I don't know, this sucks. It's hard. We got each other, and let's keep going. So,
Laura, I want to go back to the culture question for a moment, or the cultural topic, because I sense that things are run differently at Foundations Health Solution, and you've been there long enough. You've been at 4 or 5 different long-term care organizations. So I'm interested in, what is it like working with Bob and working with Brian Kohler, and the owner? We've listened to the podcast. I want to hear what is in the day-to-day, what your first impression was.
At first, when I started 6 years ago, when they tell you we're not we're not a company that needs like unnecessary meetings. We are not a company that has you do reports unless if it's by exception. I kept thinking, okay, sure. Wait till the first thing that goes off, that's going to go the wayside. And it didn't. So years of being brainwashed the old school, it took me about 6 months. And I'm like, you know what? We are getting the exact same results here. As an administrator, our administrators are on the floor 3 to 4 hours, and it's just helping pass trays, connecting with residents, staff. So that's the difference. We tell our administrators, first and foremost, your relationships with your staff, ensuring, if there's a resident that's having challenging transitioning in your building or into your building, that's our priorities as leaders, and being that voice versus your priority of your key factors and PPDs, because we really do believe if we do it right, directly on hands-on with our residents, the numbers, everything else follows. And it's very true. It does. So it's a different lifestyle. You don't, I've been in companies where you start your day at 8 a.m. and you don't come out till 1:30 from your meetings and just running data and all of that. You actually know the people that are in your building. It's beautiful.
I don't want to get Bob in trouble, and I think this might be news to Victoria. Bob is organizing an STNA day, a Frontline Caregivers Day in September, and he invited me to come and speak with him, and I'm really excited because hopefully I'm going to get to meet you in person, Laura. Can you tell me a little bit about how you all take care of your frontline caregivers differently at Foundations, and what you're proud of for working there?
Oh my gosh. Again, it's difference in conversations, difference in focus. So when I talk to my administrators, because they're now my hands and feet, we talk about, tell me what you're doing for your staff. How's the vibe? How's the mojo? What's going on? It's just not a chili party once a month. We want those fun events. What are you doing? What's going on in people's lives? Oh, we've got a baby being born. They just do it organically, but not missing those moments. I have seen surprise day managers washing all of the staff's cars. There's more food. I'm telling you what, I don't know how, thank goodness everyone moves so fast, because they feed our staff all the time. I'm like, man, you guys are junk food junkies, but constantly.
Is it true that you had a cook-off, that you had all of the buildings have a cook-off and see who could make the best food?
We did, from all of our 60 buildings through the state, and then each region brought it down. And I'll tell you what, they threw down. It had to be food. It had to be a menued item that you already serve. So, you know, it has to be something you serve to your resident. So what that did, that whole 6 months leading up to it, let me tell you, they were really taking their menus and piling on stuff and how cool can we make this? I think someone used like a spicy Pringle as a cover for I'm like, oh, that spicy Pringles, didn't know they existed on chicken. They called them pot fire chicken. And it was just amazing. And this is what the residents eat. So not only was it fun, but it really did engage our chefs and the staffs. It became a fun competition in the buildings. Yeah.
Thanks for sharing. It makes me hungry. I don't know about you, Victoria.
Yeah. Oh,
good stuff.
that's impressive. That's so cool.
Yeah.
So go ahead, Victoria.
Yeah, I was gonna ask the same question. I was wondering if I wanted to do what you did, and I wanted to start as an administrator and go through that path. What advice would you give me?
Well, first, I guess the main criteria, you do have to have a bachelor's degree. And you know, once you get that, and it can be in anything. You can be in engineering, you can have your bachelor's degree. Once you have that, you have to do like an internship with an administrator. That's a 9-month internship. And then you have I think it's like a 3-week course that you take, and then you test for your license. So beyond those technical requirements that you have, I would encourage, you know, look where your comfort level is in your skill set, because regardless, even if no one's ever worked in a nursing home, you know, you've got your mechanical people. I've had maintenance directors become administrators. You've got people in dietary. You've seen the dietary managers come up and out. So depending where your passion is, I would say enter at wherever your passion is or where you feel your skill set is today. Most administrators, if you've never been an administrator, will start in like a social services position or human resources, the business office, and then they grow from there. Just to, you know, once they get the lay of the land, we can promote up from there.
And in terms of,
sorry, go ahead.
Oh, sorry.
No, go ahead.
In terms of personality traits, like what does a good administrator, what's the personality of a good administrator?
I'd say someone that's approachable. That one of the things I really look for is we get lots of stories every given day, and someone that really does get, there are 2 sides to every story, and don't jump to conclusions. So someone that can methodically listen intently, empathize, and okay, let's get this other side, and then make a rational decision. I look for that in my leaders. I look just someone that is respectful, but that can hold high standards. So you can be kind and you can be all those wonderful, soft things that people like. But at the same point, when it comes down to it, we have a very important job to do, and we've got to make sure we're doing it. So when we have those conversations, the why, we're holding people accountable so we can get those outcomes.
I want to take a brief break and thank 2 of our sponsors, Experience Care, one of America's oldest and best EHR, for sponsoring our regular live. And then I also want to thank IntelliCare. IntelliCare is a agency app that I am excited to be partnering with. And they have a phrase that says, does a pizza party for Nurses Week sound underwhelming? Nursing professionals, the backbone of our healthcare system, deserve so much more for keeping us healthy and safe. That's why IntelliCare is reimagining how to show nurses appreciation for Nurses Week in 2022. The LTC cruise is heading to the Bahamas this May to give nursing professionals 5 days of sun, fun, and CEUs. I'm going. LTC Heroes is going. To learn more about IntelliC, visit intellicare.com/cruise. To wrap things up, Laura, I always ask this question one way. Oh, I know I have 2 questions. I lied to you. The second to last question is a question that I ask kind of as an NFL question. And it says, I think it was Lawrence Taylor who said that he gets paid to be a football player Monday through Saturday. On Sunday, he works for free. What part of your job is your Sunday football day where you'll work 100% for free? Was that Willie Nelson?
That's Willie Nelson. There he is. He's singing to you. Gosh, there's 2 things that just get me. for, when you see residents that are just getting to like an activity, something so touching. Last week I was in a building, it was cute. I came in after St. Patty's Day. And all of a sudden I noticed at first I saw a tattoo like here on someone. And then I saw this little lady with like a neck tattoo. I'm like, oh, guys. So then I sat down and heard like the day before they'd had green beer and tattoos. And I mean, I had residents with tattoos all over. It's that like, that's probably not something your regular 90-year-old lady is doing. And they're having a blast with it. So that in those moments, you're realizing like, yeah, they might be old, but we're giving them fun moments. We're not just calling bingo. So those are precious moments. And that, they were giggling and taking pictures of the big old snake tattoos, which I thought was absolutely hysterical. I loved it. And the other thing is those staff members, when you just connect and that this is more than a job to them, that they love the residents. I heard of a staff member, we live in Columbus, and these are the moments that just touch your heart. I'm like, yep, that's it. You nailed it. That's why we do what we do. Anyway, the resident lived in West Virginia. We're in Columbus, Ohio. And the resident just simply was on hospice and simply wanted to go home and pass away or spend his last time at home. Well, the family couldn't get up here. And so a staff member actually volunteered, unbeknownst to me, to take that resident on their day off down to West Virginia. And they tuck that resident into the home. And of course, when I hear that story, I already hear it like a week later. And that employee did that on their own. It was that quiet gesture of love and respect. And that's what that's what I'm surrounded with. That's just those moments where I'm like, yep, I'm in the sweet spot, knowing that's what I get to be surrounded with.
Thank you for sharing that. My last question is, Victoria and I read on your website this morning that Bob Spillman did a shift at your facility back in 2017 or 2018. Yeah. What is Bob like as a STNA?
Holy smokes! I'll tell you, he no one's gonna believe it. The man is, when he's in your building, they're like, "Is this for real?" I'm like, "Oh, he's sweating full on." And he's like, "Let's lift." And I mean, he's in there lifting people. "Hey, this shower chair, you need a better shower chair. The wheels are squeaky." Okay. I mean, he walks out, and whatever the staff, I mean, it's contagious. And at first, when you first see it, you're like, this isn't real. Are you punking me? I've seen it actually back in that visit. I remember it was a brand new building he was in, and the nursing aide said, "This design on the shower is wrong because I can't get the wheelchair. I can't get this in. This design's wrong." And he's like, "Well, this is a problem." So he honestly took this aide to meet our architect so the architect could hear from the aide, and our next building was designed differently, and every building since then. So it's that moment. A nurse's aide said it didn't work, and it is kind of clunky. It's not that way anymore. He's full on the real deal. When he's as an STNA, yeah, amazing. But he's always sweaty. I'm like, I'm not touching him, man.
He's like the sweaty forward in basketball that you don't want to play.
100%. He'll box out, and I'm like, I'm out.
Bob, we love you. We just don't want to play basketball against you.
Not at all.
Lura, thank you so much for joining us. I want to thank Foundations Health Solutions. They are one of the reasons that we started our live streams on LinkedIn for Frontline caregivers. It was Bob Spillman's inspiration, and it's one of the reasons that I'm excited to go meet with you all on your CNA and STNA day in September, and hopefully I'll meet you in person. I promise I won't be as sweaty when I give you a hug, Lura.
I love it. Well, I will be there. Nice to meet both of you. Thank you.
Talk to you soon. Thank you so much.
Thank you.